Hello, Tidewater family. I know that it's that time of the year where AHIP has just opened up and a lot of you are starting to think about 2022 and starting to make a game plan for yourself, for your agency, to determine how you want to take care of yourselves and your clients. And I want to come to you today just because we've seen some things that appear interesting this year. One of those being that there are going to be more options for individuals as far as Medicare Savings Accounts go. And I don't know if you, as a business owner, as a partner of ours, have really considered Medicare Savings Accounts in the past. I know that in some areas there are no Medicare Savings Accounts. In other areas, they've been very limited to maybe just one carrier. But I have a sneaky suspicion that there may be some expansions going on for 2022 in the MSA markets. And for that reason, I think this could be a good time to investigate anyway as an agent into the MSA markets. I know that for some agents that I've talked to, because I do try to seek advice from agents. I do ask about what's going on in their markets and what they see. And, there's just getting to be so much competition in many markets that it can be overwhelming to the agent as well as the consumer. But the Medicare Savings Accounts could be a really good option for some individuals. I definitely don't think that they'll be for everybody because it's going to be a little bit more, I don't know if sophisticated is the right word, but it's going to be a product where they need to understand how it works. Because with a Medicare Savings Account, it is a Medicare Advantage product, but it is totally unique in that with a Medicare Savings Account, there are no extra benefits, such as dental and vision and hearing included into the core product. There's no premium, which again, statistics tell us that about 65% of people around the country like the zero premium. There's no prescription drug benefits that are built into it though, so they will have to purchase a separate drug plan. And the plan pays absolutely nothing on preventive care, unlike traditional Medicare Advantage plans. So with the Medicare Savings Account, basically what happens is the private company, whoever that may be, will make a deposit into a special health savings account for the Medicare beneficiary. At that time, the Medicare system, the original Medicare system, is hands off. Everything will flow through that private company just like a Medicare Advantage plan does. However, that plan is not going to pay any bills at all, preventive care, primary care, anything, until their deductible is satisfied. Let me just give you an example. Let's say that said company puts a $1,000 lump sum into a health savings account. Now, this is a Medicare savings account, but it's still going to be separated for health care expenses. So that $1,000 is placed into the account on January 1st. At that point, the consumer is responsible for all medical bills until, let's say, $4,000 has been met, and they call that their deductible. So the plan has a $4,000 deductible. Well, if they've put $1,000 into the account, the insured can then spend that $1,000 first. Then they're responsible for the next $3,000. At that point, the plan picks up and pays 100%, thus giving a $3,000 maximum out of pocket if all of those expenses are used for medically approved expenses. What I mean by that is that the consumer can actually take that $1,000 that was deposited in their account the first of the year, and they can use it for dental, for vision, for hearing, but those do not count towards the deductible. Only Medicare approved medical expenses will count towards that. So if they do use it for Medicare approved medical spending, their MOOP or their out-of-pocket maximum is only $3,000, which makes it a very competitive product. It also will allow that consumer to be able to select their own drug plan so they can customize it and not have to take one that's already been made for them in a comprehensive package that most Medicare Advantage plans offer. So if you have a client that maybe they've had a Medicare supplement plan, and that supplement plan they've liked, they've enjoyed, but the premiums are now getting to the point where they're just not affordable, but their health is such that they can't go through underwriting. A Medicare Savings Account may be a good product for that individual because they've already had a drug plan, so they're accustomed to paying the premium for a standalone drug plan. And with this plan here, no premium, zero premiums. Another nice thing about the Medicare Savings Accounts is that there is no network. The insured can go to any doctor, any hospital, anywhere in the country as long as it's a Medicare approved facility. So their maximum risk is $3,000 with this plan. So they can keep their money in their back pocket, save the premium they've been paying on that very expensive supplement plan, and could potentially spend less, or it may be factual that they will save no matter what happens, because if they reach $3,000, they'd be capped. Now, that's just an example. I will tell you that there are some plans that are going to be around in 2022 that are going to look similar. There's probably going to be some that may even be a little better than the example that I've just given you. But I am really excited about the Medicare Savings Account. So when you prepare for this annual enrollment period, just be sure that you don't kick the MSA plans to the curb. Make sure they have a place on the table with you. At least consider them when you see the information coming out, because we're dealing with a more sophisticated client than we've ever dealt with in the past. They're coming from HSA accounts. They're very healthy. Individuals are living longer. Those supplements are getting more expensive. And so all those types of people will fit into the category that could potentially consider a Medicare Savings Account. If you have any questions, don't hesitate to give us a call at the office. We look forward to your calls. We enjoy your partnerships, and we enjoy the friendships. As always, I wish you the best.